Hi there, and hello everyone. Thank you for your patience as I hop on. I had some type of family emergency. So I do apologize. Of course, we're working together to save our families, our communities, and our way of life. Thanks for hopping on and watching Canceling COVID. I'm Tanya Rivens. I want to say thank you to our sponsors, Mecklenburg County Public Health, meccountync.gov, meccountync.gov, available to answer any of your questions. There are lots of questions about COVID, and we continue. Keep in mind the pandemic is ongoing. It's not over yet. And I know it seems like it as we're out and about and just enjoying this beautiful weather and enjoying one another. It's been a long time, but keep in mind we still have work to do. So, again, thank you to Mecklenburg County Public Health. If you have any questions about COVID 19, they're more than happy to assist you. meccnc.gov, or you can call 980-314-9400. Now, we're also grateful for Groundwater Solutions. They are supporters of Canceling COVID. And we've been doing this since January, and we've been getting lots of great feedback and providing a whole lot of great information. The Delta variant, you've been hearing more and more about that now. It's a more contagious strain of coronavirus, and it now makes up more than half of the new COVID 19 infections in the United States. More than half. So that's more than 50%. That's quite a bit. But it's not like we hadn't been warned that this was headed our way. So we're starting off today with a look at the big picture right here in our local communities. And it's truly an honor every time I have them on. And I apologize for making them wait. Just had something to drop in yesterday, but I've got Dr. Renee Washington. He's one of my favorites. He's with Mecklenburg County Public Health, and you've been more than accessible. You've been very helpful. And so I'm glad to welcome you to the show. Deputy Health Director at Mecklenburg County Health Department. And you guys have done a wonderful job keeping everyone informed, keeping everyone involved. And I would say to a certain degree, helping to start rebuilding trust from our community to Mecklenburg County Public Health. So for that, Dr. Washington, I wanted to acknowledge and say thank you for all of your work.
Thanks. I appreciate it. Thank you for your work, Tanya.
Absolutely. So let's talk about starting out. What's your biggest concern about the Delta variant?
I think, as you've already alluded to, the variant does seem to be more contagious, which means that it spreads more quickly to individuals. It's more transmissible, so it's easier for one person to infect multiple people. And so that is certainly concerning as we are continuing our drive to get as many of our citizens vaccinated as quickly as possible. We continue to push and really make sure that we're making information available to everybody about the vaccine so that those who are still a little bit hesitant hopefully can get over the hump and get in to get vaccinated. You know, we are about just under 50% of our adult population, 50% of our total population has received at least one dose. So we still have a long way to go in terms of vaccination. So with that level of vaccination and the variant still spreading in our community, and as you've already alluded to, people still getting together, being around one another more and more as more things are open and available to the community. Those folks who are not vaccinated, of course, it's concerning that they may get infected, and of course, unfortunately, may have severe complications due to it.
And I see our listeners and viewers starting to hop on now. I appreciate that. Good afternoon, Erica Simonton Beatty. We appreciate you all continuously showing up every week to get information that is driven by facts and no other political purpose, just to inform you. So thank you for hopping on. She's a regular as well. Now, let's talk more about the Delta variant. It's especially dangerous for the vaccinated, which you just mentioned. What do you say to people who argue that this is a scare tactic just to get people vaccinated? And can you speak on, or you already spoke to the fact that it's easier to pass along to others? So when people say, oh, that's just one more thing that they're just trying to scare us, to get the vaccine, what would you say to that?
I think, of course, this entire pandemic, Todd, as you know, there has been uh, all kinds of misinformation. And so we certainly continue to try to work against that misinformation. Certainly the variant is not all viruses mutate. Every virus that we have and know of, when it finds a home, it gives it an opportunity to mutate. Because when viruses infect your body, they basically start to replicate, and in those replications, sometimes things go off, and it sort of turns into another version of itself. And so mutations happen all the time. And so sometimes, and usually the mutations don't have any real consequence. But when we saw that this particular mutation in one country was starting to spread more rapidly, there were more infections, it was clear that there was a greater level of transmissibility with this particular mutation. This is, as you said, this is not the first variant that we've had that's been a little bit stronger, a little bit smarter than the previous variants or variants of the virus. And so I think, as you also said earlier, COVID's still in our community. So I know things are open back up. The community is available to people. There's activities happening. There's events happening. But certainly there continues to be real spread and transmission of the virus in our community. So getting vaccinated is your best chance at, of course, trying to protect yourself and those that you love.
Yeah, talk about community events. I mean, it's like a long laundry list, especially on the weekend. It's like people are busting out of the woodworks. You need a break from the break that we had, and then it's like all of a sudden everybody wants to do. It's like from feast or famine. All of a sudden, lots of activities, and make sure people, keep in mind to pace yourself because you can't do it all. And during the weekend. Now, we've watched the demand for the vaccinations dwindle, Dr. Washington. What are you all doing to kind of reach those who remain unvaccinated? I know that on the national level, the president has suggested going door to door. And I know locally, Mecklenburg County Health, you guys have, implemented and tried some ways. We see the lottery, the opportunity for kids to get, scholarship money. These are all great ideas, but what are the things, are there some things that we're doing locally in the county to try to get more people vaccinated?
Yeah, certainly. So we're obviously pushing the word and information out about those opportunities that the state has made available to folks in our county to be in those lotteries. We are part of the cash program as well, so the gift card program. So we've been giving out $25 gift cards to everybody that comes in and get their first dose with us. We've also
Mhm.
been giving out $25 gift cards to folks who drive people to the clinic, and you can get multiple gift cards if you're transporting, individuals on different trips. And so we've been doing that, which has certainly been a real benefit to some in our community, and folks have been excited about those. We had a raffle of some airline tickets a couple of weeks ago.
Yeah.
And then, yeah, we had two free tickets to anywhere in the world on Air American Airlines, thanks to their donation to the county. And so we continue to try to be as creative as possible. We're also just trying to make access as easy as possible. So we're showing up wherever we can. Like this afternoon, right now, we have a team at the transit center because we know people go through that center, that space, especially with people being out and about more. And so it's been really busy all day today because, again, it's really easy, it's really convenient. We've been going to all kinds of festivals. We went to the Summer Block Festival. We'll be going to other kinds of activities throughout the summer. And so again, we're just trying to make sure it's as easy as possible, and where we can offer incentives, that we make sure we give folks something that just a little extra push to get them in and thank them for their service to the community, because it really is a service to the community as well as themselves.
And we're grateful that you all are doing, it sounds like a lot of grassroots efforts now, just making every attempt to connect with people. So now national experts are throwing around the idea of a fall COVID-19 spike around the time children head back to school. What are you seeing, or kind of your pulse on that for the county?
Yeah, so we certainly anticipate that, again, the virus is still here in our community, it's still spreading. During the summer months, we typically, just like with the flu, you tend to see less transmission because people are spending more time outside and less time indoors. And a lot of the activities that people are engaging in are designed to sort of have lots of air filtration, social distancing, because people got more space out, have more space outside. So we do anticipate that obviously the virus will still be around in the fall, and as people start to come back indoors more frequently, as people start to go back to offices, as kids go back to school, again,
Right.
all those create opportunities for the virus to spread among people. And certainly, those individuals who aren't vaccinated would be at greatest risk for getting most sick from as a result of those potential infections. So, we do anticipate that there probably will be an uptick in cases. Our cases right now are very stable in Mecklenburg County. We're seeing roughly, 40 to 50 cases per day. Our hospitalizations are at an all-time low in terms of how many people are in the hospital, and we know that that's at least partially due to the vaccinations that are happening in our community. The majority of the people in the hospital with COVID illness have not been vaccinated, the large majority, over 99%. And
Mm.
so we have clear real world evidence that the vaccines work. And so we're hopeful that our hospitals will still be able to obviously maintain their operations, even if we do start to see a surge of cases in the fall.
Yeah, and I often shared, it was great this past fall not to have to deal with all the sniffles and the coughing that we normally see in the fall and winter months, especially in the winter. So wearing that mask, during that time, I think for some, I know for me, is going to be something that I plan to stick with because it was just really nice to not have to deal with that, not to take away from, the flu shot and other vaccines that are available for people. But I wanted to talk about what the county is now seeing an average of 44 cases per day. 6 months ago, that number was 762. You kind of already alluded to, things holding steady. But to go from 762 to 44, that's some real progress. What goes to your mind? I saw your reaction when I said that. And for anyone that reads those numbers, they should have the same reaction.
Yeah, I call those the dark days, where some days we
Yeah.
even had as many as like 1,500 cases in a day.
Oh,
Another important statistic that I think means so much to us because of the amount of attention that we paid to it is the number of outbreaks we have in nursing homes and long-term care
yes.
facilities. I think that number is down to five or fewer, and they're very small outbreaks at this point because the majority of those
Mhm.
folks have been vaccinated. So I think certainly we are feeling a bit of relief, I guess. I
Yes.
think I posted on Twitter the other day. I'm starting to feel a little more human than I had been feeling the last 16 months, because certainly we are, our response is able to stabilize a little bit. We're able to really not be in the really sort of rapid fire mode that we had been in as a health department and a response team. But also it means that our community is doing the right thing. I mean, people are being more conscious of their behaviors. People are getting vaccinated. And I think as we are starting to normalize some of these really important tools that we know work, I still see a lot of folks wearing masks, which is really encouraging.
Yeah.
And I think it's great that people, even those that are vaccinated, I still wear my mask on a regular basis. Continue to do so just to avoid any potential infection or spread that may happen as a result of folks being back out and about. And so I think we're feeling good about where we are at least right now, but also we're cautious. We're cautiously optimistic. Hopefully hoping that the fall surges will be contained. And again, most importantly, just trying to encourage everybody to go ahead and roll their sleeve up and get their shot, because once more of us get vaccinated, that gives the virus fewer opportunities to transmit and to get folks sick, and obviously keep everybody alive.
Well, kudos to the county for the progress that we've made. We talked about the nursing homes, and yeah, those were truly dark days where we had been as far as the past. But moving forward, kind of where we are at with deaths, because obviously once people started to get vaccinated, we saw that number decrease, and which was very encouraging. So where are we now with the county along those lines?
Yeah, so our deaths have really, really slowed down pretty significantly. I want to say last week we had been like 10 days before anyone had died from COVID, which is
Wow.
incredible progress given that there were some days where we had 10 people die.
Mm,
And so I think that is certainly a testament to, again, us being able to contain the virus and not have it spreading in among our most vulnerable people, our seniors, our adults. And so I think that's encouraging. Over 80% of our older adults are vaccinated. So vaccination rates are much higher in those groups. And so that's helping with, avoiding death in individuals. And I think in the last probably 2 or 3 weeks, I think we've only had 2 or 3 deaths. Which is certainly encouraging. Again, like I said, there were days where we had deaths every day for weeks, months even, and then some days as many as 10 or 12 deaths. So I think we are certainly encouraging that people life's being protected. Folks are giving hugs to each other, and so I think we're really encouraged by sort of the progress we've made to date.
yeah, and you mentioned hugs. What a great way to wrap up the interview on. It's so nice to hug again and to greet people and to shake hands. I miss that. Just loving on each other. It just means so much. So thank you again for talking with us. Any final thoughts as we wrap up? And I'll send you a virtual hug or a
Yeah, I
virtual
appreciate it.
handshake, Dr.
I look forward
Washington.
to meeting one
Yeah.
day in person. No, I encourage
Yeah.
folks to go out and get your shot if you haven't gotten it yet. And of course, thank you, Tanya, for all you're doing to make sure our community has the right information and has it from trusted sources. So thank you, and keep up the good work.
All right. Thank you, Dr.
Thank you all.
Washington. The same. All right. Enjoy the rest of your day. Again, Dr. Raynard Washington, Mecklenburg County Public Health, a sharp young man that has worked really hard to help rebuild trust and to work with the community. And we're so grateful for that. So we just got some new numbers from COVID-19 numbers for the state. Right now, there are 231 new cases in North Carolina. That's up a little after the holiday weekend. Meantime, 13,000, and let me verify this, 13,455 people in North Carolina have died. And that is, they've died from the virus since the pandemic began. Guys, I work with a teleprompter, and sometimes it kind of has a mind of its own. So let me go back and repeat that just to make sure. 13,455 people in North Carolina have died from the virus since the pandemic started. But I want to also kind of shift the conversation now to a group that's also doing great work in the community. We all work to find a new normal, and we can't forget about the most vulnerable in our community, people, young people, children in foster care. And I discovered this group, I've been probably about 3 or 4 years ago, and they've been really amazing with the work that they've done. And when I share the story, people are so excited to hear about it as well. I'm honored to bring in our second guest, and it's Nicole Taylor. She's Executive Director of Congregation for Kids. And Nicole, we've talked so many times by email, and I do apologize my delay today. Hopefully, Amelia told you I had a family emergency, but I certainly am glad to get you on and to talk to you because the whole concept and everything you've done, of course, is built around the word, which we stand on, and as believers, something that you all decided to come up with and start addressing. I just wish more people could catch on to it. So, first of all, let me say good afternoon, Nicole. Thank you for joining us.
Thank you so much for having me. It's so good to see you virtually.
Oh, same here, Nicole. So, now this Congregation for Kids, a lot of people aren't familiar. It's on a mission to be a champion for every child. So, why don't you explain to our viewers exactly what that means?
Sure. Congregations for Kids, or CFK, we work to help equip and empower champions within our community for kids, children, families within the foster care system. And we do that through four specific pathways: foster, mentor, serve, and give. So we have lots of different ways in which people can come around children and families within the foster care system.
So, working with the foster care system, how many do we currently have in Mecklenburg County? And has that number increased or decreased during this pandemic?
Sure. So typically, Mecklenburg County has anywhere from 500 to 600 kids in foster care on any given month. Right now, we have about 550 kids in foster care. That slowed down over COVID around March and April of last year. The
Mhm.
number of kids coming into care slowed down because teachers are the number one reporters of abuse and neglect, and of course, kids were not in school. So the numbers decreased in terms of how many kids were coming into care. But those kids that did come into foster care, their circumstances were more extreme in nature, unfortunately.
And that is unfortunate. And let me just say here, the one thing that really drew me in when I started working with you guys, and even just I probably took it for granted because when I shared with my producer, she's like, "Oh my goodness, this is an amazing organization." What really stuck out in my mind as someone that works in the community is we have all these ministries that work and support orphans outside of the U.S., and that's great. That's what we're called to do as believers, but our foster care system is our orphan right here. And when you guys said that to me, I'm like, oh my goodness, that is the exact point that everyone needs to acknowledge and work on. That's
Mhm.
what's happening with our kids. And you're right. We have our own orphans here, and we should be nothing wrong with supporting outside the US, but let's support what we have here as well. So I salute you, you guys. I appreciate the work that you're doing. And you just touched on teachers are the ones that usually are the ones to make and notice and report. And they've had so many challenges with the remote and hybrid systems. So these kids are out of school. Social workers probably really challenged, not allowed to do home visits. So what was the workaround?
Sure, great question. And just to your point, the United States orphanage is the foster care system. And I was actually in international orphan care for 10 years. And
Mm,
then my husband and I became foster parents, and so that really shifted my focus to what was happening in our own city, so I can relate to everything you just said. But in terms of COVID, there was a lot of workarounds. I mean, child welfare nationally in our country is broken, and anyone that
mhm,
works in it will tell you that. Now that doesn't mean we turn around and we say, okay, let's not help these children. We still have
right.
to be there for these kids. However, COVID turned it upside down, not in a great way. So you had biological families that had to visit their children that were in foster care virtually. You
Mm,
had foster parents who were now working at home, parenting children who had been through trauma, teaching, and they were doing all of this in isolation. You have social workers who were having to visit vulnerable families, what we call pre custody, virtually, not in person. You had the court systems that shut down for a bit, and then really permanency has been delayed for hundreds, if not thousands, of families and children as they are playing catch up now to
mm.
try to make up some of that time. So we will feel the ramifications of COVID and child welfare for many years to come, in my opinion.
And that's kind of what is frustrating when we have officials that are going by science and saying, guys, let's get vaccinated. I know it's a personal decision, and I make sure on this show I don't shame anyone, but we just
Hmm.
cannot afford to go back to where
Hmm.
we were in the past. We just cannot. And I think everyone, if they would look at it from that point to do their part. And again, the whole issue of foster care, the system being our orphans, if more believers would look at it that way. I salute you guys for bringing that to my attention and pointing it out in that manner. So, what are some of the, you acknowledged and everyone acknowledges that the system is broken. So, what are some of the other issues that impacted foster care during COVID? You mentioned already the court cases and adoptions and the visits. Anything else that you would like to add to that?
Sure. I think the group that was most vulnerable during this season of COVID has been those youth that have aged out of the system. So
Uh,
they have aged out without permanence, and now we're in a crisis. We're in a pandemic, economic crisis, a financial crisis, and when you don't have a support system, you very easily can fall prey to a number of really terrible outcomes. And
mm,
so we know what kids face once they age out if they don't have permanence. But we were never really connected to them as an organization. And what COVID did for us, it had folks that have been in child welfare, social workers calling us, say, hey, I had this kid on my caseload 2 years ago. They're in college now. They aged out, but their college shut down. Now they're homeless. They're in tent city
uh,
uptown, and so we were able to connect with about 175 aged out youth to come alongside them during this season because they were the ones losing their jobs. They're working in hospitality, they're, couch surfing, they're living out of their cars if they even have a car. And
oh.
so it was a group that we as an organization were never really connected to. And so that really opened our eyes to be able to come alongside that community over COVID. Really, in child welfare right now, we're sort of bracing ourselves for August because this will be the first time in a long time, nationally speaking, that kids will be back in front of teachers. And so there is this unfortunate prediction that more kids will come into care once teachers are seeing kids again face to face on a consistent basis. So we're ramping up our efforts to recruit and train foster parents. We are doing lots of things now to kind of prepare for, what research and data tells us is likely to come.
And Nicole, it makes me so sad to hear that, especially, through no fault of theirs, that, when we're headed
Hmm.
back to school, it's great now we'll have some eyes on them. But just to hear you tell the story of those that ended up when the schools, colleges shut down and they ended up in tent city or couch surfing, which is really unfortunate. Annie Allison has hopped on. She says, thanks for sharing this information. Thank you for
Hmm.
hopping on. Tanya Harden says, they have nowhere to live, no job skills, no hope in most times. And I always say, as believers, we have to make sure that we can just push and encourage people to keep hope alive, although that sounds corny. But I think when people lose hope,
Hmm.
then it's just so devastating from where we're headed. You guys have done an amazing job, though, of adapting and making the adjustments. So, recruiting more foster care parents obviously is one of the things that people can do to support. Can you speak on how people can get involved as well as how people can donate or just volunteer? You know, I haven't been the best volunteer, but I've always tried to do my part. And I'd share with the producer when you had the opportunity to provide a meal, something as simple as provide a meal for a child and the parent that they were with, you know, just they do a little night of preparing that meal. And I thought, wow,
Mhm.
that's just so cool to come up with those ideas. So, kind of speak on what we can do more of to support a congregation for kids.
Sure. Thank you for asking that question. And you've been an incredible volunteer for us for years. So I'm grateful for you.
Thank
Um,
you.
we we believe that everyone can do something, right? So not everyone is called to be a foster parent, but everybody can do something. And
Right.
so, excuse me, we really feel like we have several different onboarding pathways of what you're comfortable with. One of the things that we launched in excuse me, one of the things we launched in early December is what we call our Care Now platform.
Hmm.
And it's a way for the community to meet immediate, tangible needs for children and families within the foster care system. So we get those requests directly from child welfare social workers. And it's a great way, especially now when people maybe aren't necessarily comfortable getting out there and volunteering yet, to connect with the story, connect with the child, meet a need that's going to help stabilize their placement or help that family potentially keep their kids out of foster care.
Right.
Excuse me.
That's okay. That's okay. If you need to get some water or anything like that, I think Amelia put up the information for Congregation for Kids, the website, cfknc.gov, cfknc.org. So, I'm sorry, cfknc.org. And Nicole, she's so kind. One of the other ways, which I think is really cool, and I just call it kind of adopt a social worker, which is an
Mhm.
opportunity for you to send them just inspirational notes, drop them a gift because their work is really hard. It's tough. And so what you
Their
do
work
is you encourage them. Yes.
yeah, no, I am sorry, I didn't mean to cut you off. Their work is
No.
really difficult, especially this past year. And so, people don't necessarily correlate. Well, how does that relate to kids and their experience in foster care? When kids have one social worker for their duration in foster care, they'll get permanency 74% of the time. But as soon
Mhm.
as there's turnover, again, social workers, there's high rate of turnover because their job is so difficult, that permanency drops to 17% as soon as another person comes in to try to help learn all the stories around that child and advocate for that child. So it's important that we uplift our social workers, and we have a program called Socialite that allows community members to do just that. And so, yeah, lots of different ways to get involved. And we're grateful for your advocacy and just letting the community know that these kids are not invisible. Although you
Right.
you don't see them, you don't know their stories. I often say we're a nonprofit. We talk about kids and stories in which we cannot really show you, so we
Right.
have to be
Right.
creative. But these kids are out there. They deserve love. They deserve stability, and they deserve safety. And it is our job. It's our responsibility as a community to provide that for them.
Especially for those that believe in the word of God and are believers. That's a great way to be a light. So I really appreciate you. Anything else as we wrap things up so you can go? I spent enough of your time, taking enough of your time on this afternoon.
No, Tanya, just so grateful for your advocacy and giving us the platform to be able to share about this and exposure for these kids right now that so desperately need it, these kids and these families. And so we're just grateful to you and all that you do in the community.
Thanks, Nicole. And that goes back at you. I so appreciate you. And I'll be in touch. We're working on something that's for National Spotlight, and Congregations for Kids is obviously a great candidate to help spread that information as well. So thank you. Enjoy the rest of your day. And again, I appreciate your patience on me hopping on. Talk to you soon. All right. So great conversation. Yeah, obviously you guys you understand and can relate to what she's sharing, and so I appreciate you hopping on and commenting. And let's get it together and do our part to help support. Of course, today's the big day. Someone in North Carolina is going to win. Is it time for the $1 million again? Yeah, another drawing for the COVID-19 drawing for vaccinated children. Of course, they get a $125,000 scholarship for college All of that's really great stuff. And that's for anyone who has received one vaccine in the state. They're entered into the drawing. So hopefully you've gotten your vaccine. If you haven't, there's going to be 4. So this is number 2. So you still have time. I heard some people talking about it. I got a chance at $1 million. Yes, you do. If you're like me, you don't play the lottery. Well, you're grateful to have your name entered this way for sure. Also, it looks like we were wrong. COVID-19 has not created a baby boom in North Carolina. I wonder why. A lot of tension and not a lot of love in the homes as you're stranded. That's just a thought. Anyway, new reports show the state's birth rate fell about 3% from 2019 to 2020. And of course, skyrocketing unemployment rates may be to blame. Yeah, if you don't have any money, that creates quite a bit of tension in your home, and definitely not any thoughts of bringing someone into the world or multiplying if you're not able to provide for them. Of course, we know that being set financially, even if you're not quite where you need to be, especially you want to make sure that you're able to at least maintain. And with the unemployment rates that we had, it would have been quite difficult. So that's an interesting nugget to share with you. Of course, it's time for me to move on out of the way. I appreciate your time. I appreciate your patience. Again, I mentioned that I had a family emergency. I had a dear, loving aunt that transitioned on yesterday and loved by so many. And so some things that pulled me away that I was trying to hop on. But I'm committed to being here with you every week. And I appreciate your commitment to being here with me every week as well. We'll be back on Friday with more great information. So as always, life's challenges make you better, not bitter. I'm Tanya Rivens. Thank you so much for hopping on. Thanks for your feedback. Thank you to Dr. Washington and to Miss Nicole Taylor. Of course, Mecklenburg County Public Health, we appreciate your support, as well as Groundwater Solutions. Thanks, everyone. Enjoy your day. Be safe, and keep in mind, together we will continue to cancel COVID. Take care.